In continuation to the presentation, here is Mr. Ahmed. He is going to present us with his presentation.
Okay, so today's our presentation. It's about a new anti-obesity medication. It's called Lorcaserin, and then we'll talk about this medication from the a point of like mechanism of actions. We're going to talk about actually the dilemma that is this medication has been application has been withdrawn from Canada and what was the reason for that. Okay, so we're going to start right now. Okay, so just switch off the line, please. So as I said, like actually Lorcaserin, it's as I said, like we're going to really shed the light about this kind of a new anti-obesity medication, and we'll make sure that at the end of this lecture, you know more about the obesity itself in Canada as a problem, and also this Lorcaserin and why it's not approved in Canada so far. Okay, so as all of us know, guys, that obesity is a kind of a very, very big problem, and it's a pandemic problem in all over the world. And Canada is one of the actually countries suffering from a bad obesity problem. We found that actually 64% of Canadian adults are overweight or obese. 30% of Canadian children are overweight or obese. So obesity is a really big financial burden over the Canadian populations and over the Canadian government budget, as we spend more than $3.69 billion per year just to tackle and face the consequences and complication for obesity. And actually one of the things I can see that it's a problem here in Canada is lack of aid from the government of Canada to the patients' populations. It means that actually in Canada there is only 33 bariatric surgery centers. So would you imagine for that big number, we have almost 30% of patients, 30% of the population in Canada suffer from this problem, and we have only 33 bariatric surgery centers with only 80 surgeons. So you can see the big deficit of the population versus the number of surgeons we got in Canada. Second, actually, the access to the medications which has been approved in Canada here for obesity is only 3 medications, and also the access for that is very difficult. Most of these medications does need actually a private insurance to be covered, as it's not covered by the government. So that's another actually limitation of the obesity treatment and solutions. Plus, actually, in Canada here, it's a very bureaucratic system getting any of these new products approved. And we are talking about one of these products, which is Lorcaserin or Belvic, the brand name of that product. So learning object of our meeting actually today, our presentation, is first of all to describe the novel mechanism of action for Lorcaserin. Recall the dosage recommendations which the FDA has approved for obese patients. Review the efficacy of Lorcaserin as demonstrated in the clinical trials. Review the safety of Lorcaserin in non-diabetic population. And as we actually move forward, they found that actually they haven't done any trial about the diabetic patients, so there was a specific clinical trial has been done on diabetic population. So this is, as you can see, guys, the learning objective of our presentation today. History of Lorcaserin. I'm just going to give you a little bit kind of a brief about how this product actually has been entered to the market here in Canada. 2009, a new drug application was submitted from the manufacturing company. And then 2010, that was rejected over efficacy and safety problems, as they were not able to provide the government with enough data regarding the efficacy and safety. 2012, officially approved as an anti-obesity medication in the US by FDA, approved that medication, and there's kind of really like a precautions here because FDA just put a black warning. We're going to talk about that later in the presentation. 2013, the marketing authorization application in Europe was withdrawn. So basically what has happened, that the company, they already applied, put an application before the European Council of Medicine or European Medicine Council to apply for marketing the product, but unfortunately, due to some side effects, it was unlikely to be approved. That's why they withdrew their application. In 2016, the manufacturer company applied the Ministry of Health in Canada for marketing authorization, and that was the same year that product actually was marketed in the States. So actually it was approved in 2012 by the FDA, and the marketing procedure, the market process has started in 2016 in USA. 2018 application has been canceled. The manufacturer could not address some open questions, especially regarding the side effects of the product, and that's why they withdrew the submission. Okay, so now I'm gonna talk before talking about the novel actually procedure, or the novel mode of action of that product. I'm gonna really talk about other products, which is actually here in Canada, and then we can see actually the difference between the mechanism of action of all the products in the market. So here, that's only the 3 products we got in Canada. One is the Xenical. All of us actually guys know Xenical. Xenical is an orlistat. That's the generic name of Xenical. And this product actually has been in the market for more than 20 years, and it was a kind of golden standard for obesity medication. Anti-obesity means. And its primary function is actually preventing the absorption of fat from the human diet, acting as a lipase inhibitor. So what does this medication? It really blocks 30% of the fat you are intaking through your food, and excrete that with your feces without going absorbed through your body. So that's actually the Xenical, which is already here in Canada. Number 2, and this product has been in the market for almost last 6-7 years. It's called Saxenda, liraglutide, and this product actually does have like so many liraglutide. It does have like so many brand names, and it's according to the use of the product. The product is used for diabetes mellitus, and the name of it is called Victoza. And also here, liraglutide as a Saxenda, and it's an incretin mimetics, actually glucagon-like peptide 1 agonist. So how does it work? It mimics the action as a physiological regulation of the appetite and calorie intake, and that's actually the way how it does it work through our brain. Sorry about that, guys. Okay, number 3, we got the Contrave, so it's called Contrave, and Contrave is actually, it's a combination of a product which has been in the market for so long. It's the bupropion and the naltrexone. The bupropion, as you know, it's a medication. It's been in the market used to treat depression, and also used as for smoking cessation, plus naltrexone. Bupropion, guys, it's a norepinephrine dopamine reuptake inhibitor, which suppresses the appetite, and the naltrexone actually increases its effects on its receptor on the brain. Okay, so now let's talk a little bit about the mechanism of action for Lorcaserin. Lorcaserin actually, basically, the hypothalamus is the major center to regulate hunger and food intakes. We got basically either the serotonin or the what we call the monoaminergic neurotransmitters, serotonin, norepinephrine, and dopamine, regulate the food consumption. The 5-HT2 is one of the receptors. It's a G protein coupled receptor family, including 5-HT2A and 2B and 2C. So there is actually 3 receptors in our hypothalamus dealing, and some other different area of the body, dealing with all of them actually under this 5-HT2, and they are dealing with our cognitive functions, with our appetite, and also with the moods. So here we got, as we said, the 5-HT2C receptor found in CNS. We found it in the choroid plexus, prefrontal cortex, hippocampus, and the basal ganglia. So this is actually the main centers for, as we said before, the mood, the cognition, and also the appetite. Selective agonist of serotonin receptor 2. What I mean here by actually this sentence is that our product, Lorcaserin, actually, it does have 100-fold affinity, more than for what we call 5-hydroxytryptamine, which is the 5-hydroserotonin product, affinity more than the 5-HT2A and 2B. Why this is important? Actually, we're going to talk about this later. They found actually from drugs before, previous drugs like fenfluramine and other products, that really it affects both the 2A and 2B. And they found actually has a very big reason that this product actually affect the cardiac valves and what we call the cardiac valvulopathy. So the cardiac valvulopathy, they found that actually due to this affinity of that kind of 2C receptor for that lorcaserin, it does not have the same bad effect or adverse effects over heart plus some other CNS symptoms. So as we said before, low affinity to the 5-HT2A, 2B, that's kind of really one thing, so it doesn't have this specific affinity, plus there is no significant binding to other neurotransmitter like norepinephrine or dopamine. So that's versus, I mean, unlike bupropion, we talked about bupropion before, and we're saying actually it does work in both actually this neurotransmitter. So lorcaserin is a mild to moderate inhibitor also of CYB2D6, meaning that actually any product who's been like metabolized through this enzyme should be taken in consideration. The T half-life of this product is about 11 hours, and it is metabolized by liver and excreted by kidneys. And why this is important, because if any patient has moderate to severe impairment of the liver or kidneys, we should be very cautious and we should really reduce the dose of the lorcaserin. Okay, so now to really prove the efficacy, what the company has done, they done some clinical trials. One of the clinical trials has been done, it's called Bloomberg trial. It's behavioral modification and lorcaserin overweight and obesity management. It's a randomized controlled trial, double blind, over 2 years, and it's cross-arm. Means that the patients actually go from that arm to that arm just to see and to experience the maintenance of the weight loss. Major criteria. The age was from 18 to 65, men and women, with a body mass index of 30 to 45 kg per square meter, or 27 to 45 kg per square meter with one coexisting conditions. That coexisting conditions basically diabetes mellitus, diabetes mellitus is one of the major exclusion here, but I mean that was hypertension or hyperlipidemia. So major exclusion criteria coexisting of valvulopathy, and valvulopathy is that actually the one we were talking about as a side effect. Diabetes mellitus, actually, again, this trial, they have excluded diabetes mellitus patients from their trial. Depression, and any blood pressure over 140 over 90. Intervention, so this trial was done on 3,182 randomly assigned patients, 1-to-1 ratio. One group, actually one arm of this patient, they took 10 milligram of lorcaserin daily or placebo. So we got either 10 milligram of lorcaserin daily or placebo. 50% of the patients cross over to placebo for the second year maintenance of weight reduction, just to check if the patient will maintain that weight reduction if they move the cross arm from the medication to the placebo side. So this is actually the results. As you can see from these results here, the results of this, after 1 year of this trial, the Bloom trial, we can see very simply here that with a number of patients and 1,538 patients, there is a significant weight loss. Weight loss in one of them is more than 5%, and this is with B value less than 0.001. So we're talking about a difference of, here we can see that above like 45% of the patient have lost 5% of their weight, compared to placebo, which is less than 20% of the patients have lost some of their weight. Again, if we look even for 10% weight loss, you can still see a significance b-value less than 0.001. You can see actually more than 20% of the patients have lost their weight, compared to the placebo, which is less than 5%, have lost their weight, which actually you can see that there is an effect. This medication is effective if it's going to be used with the recommended dose. So as all of you know, guys, that we got intention to treat is one of the very unbiased way of clinical trials to make sure that the trial actually, so the patient has been measured where they are assigned randomly without playing with the numbers. So we can see here again that this is the body weight in the y-axis, and this is the study weeks, number of weeks of a study on the x-axis. And then you can see actually that with the lorcaserin, there is a very significant body weight reduction versus placebo from this trial. So here, that's what we talk about the cross arm, meaning that after 1 year, after year 1 year, as you can see, what we did, we switched the patient who's been on Lorcaserin, and we just put them in the placebo arm. And you can see here, the placebo actually is the triangle. So that's the triangle here, guys. Like, where is the triangle? That's the triangle here, guys. You can see this is the triangle. And then the Lorcaserin is the circle. And the Lorcaserin, after 1 year, this is actually the orange kind of really color circle. So you can see very obviously that the patients which have been switched from the Lorcaserin to the placebo group, after they lost the weight, they came up again with some of the weight. So meaning that actually we need to maintain this medication at least for 2 years to sustain the results which we have got in the first year. Limitation of this study. Number one, it's relatively short duration. As I said, like this kind of an obesity, it's a lifetime problem. So relatively short duration to assess the infrequent but serious also side effects. So one of the main drawback, as we said before, there was 2 medication in the market, like fenfluramine, like fenfan, like phentermine. That product actually was working in 5-HTC, but also non-selectively, and they work in different kind of receptors like 5-HT2B and 2A. So this trial was not long enough actually to take care of that problem. Second, the discontinuation rate was high due to medication side effects. Actually, the discontinuation rate for that trial was around 8%, which consider a little bit high comparable to other clinical trials. Patients with hypertension and diabetes mellitus were excluded from this study. So when I said before hypertension was included, I'm so sorry. Actually, there was an exclusion for that kind of patients at that study. Here, patient received also a concomitant intervention like nutritional. Okay, so again, this kind of a trial, we did it with a recommendation. As you can see, it's a behavioral modifications, meaning that we were looking actually also to put patients on diet and exercise. So the kind of efficacy we were looking for, we were not sure 100% if that actually due to the exercise and nutritional or plus the medication or the sum of them. So that was one of the limitations of this study. Again, the effect of Lorcaserin on the heart valves was not studied, as we mentioned before. So they came up with a second study, and that's why it's called Blossom trial. It's a behavioral modification and Lorcaserin second study for obesity management. Again, it's a randomized controlled trial study. Interventional, it's like 3 arms actually, which is Lorcaserin 10 milligram twice per day, so that one, once a day, this is the second one, and placebo. It was done for 52 weeks of duration, which means 1 year of duration. Measured criteria of inclusion is again the same age. We are talking from 18 to 65 men and women, total of 4,008 patients. And again, the BMI was from 30 to 45 or 27 to 29 was one coexisting condition. Measurements, primary endpoints is 5% or more weight loss. Again, 10% or change in body weight from the baseline at the end of the year. Secondary endpoints were grouped into four families. Again, we would like to check lipid profile, blood pressure, body composition and fat composition, and also quality of life for those patients. So here, again, we did some serial echocardiogram monitored, to monitor the heart valve function, which is really very important too, as we mentioned before. So here are the results of this study. As you can see, guys, that 40, again, you can look here, we got the placebo, which is the first one. So here again, it's of course, it's an inverted kind of really thing because that's the weight you want to from the baseline. So that's the weight reduction you want to see. And accordingly, and this is actually the x-axis. This is actually the weeks of the study. As you can see, actually, with the placebo, it's the lesser weight reduction percentage. When we go forward with the 10 milligram once a day, it's a little bit more. 10 milligram twice a day, it's more. And you can see this also from this distribution kind of curve, that the BID Lorcaserin is the highest weight reduction and also percentage of patients. And even with per protocol study, mean that this kind of a study is done according to whatever patients been allocated to, been assigned to. and it was also showing that we have a significant reduction in the weight for those patients who've been taking the Lorcaserin 10 milligram twice daily. I just actually picked up this kind of a chart because I just want to show you what kind of, reductions, a comparison between Lorcaserin PID and Lorcaserin once a daily and placebo. Just, I don't know, can you see it, guys? Okay, so here, as we said, that we got significant reduction in body fat composition, waist circumference, and quality of life. So actually, that product has done significant and specific reduction in body fat and composition. No statistical decrease in triglyceride or apolipoprotein B. So we mean that apolipoprotein B and triglycerides, it's not actually targeted by this medication. No increase in blood pressure. An ECG finding of FDA approved, like we can see here, like the valvulopathy. It's 2% that's in the group which been taking the 10 milligram, and 1.4% in that group which actually taking once a day. This is twice a day, this is once a day, and 2% again in placebo. So in this kind of trial, if that side effect, which is the main measurement or the main concern here, it's almost compared to placebo in that trial. So again, that's the adverse events actually of Lorcaserin compared to twice a daily, once daily compared to placebo. What I can really pick up for you here, guys, is basically we can see that the discontinuation of the medication due to the adverse events. You can see actually it went up to it's a 3.1 here and 3.4 versus 2.2 of the placebo. So actually in this trial, it was not bad as blue. In the discontinuation, it's less than 3-4%, which is not very significant percentage. We got headache, one of the major side effects of that medication. It's more than 15%, we got it versus 9% only in placebo. Also, we got fatigue, one of the main important, one of the main side effects we see every day with that medications, and also the dry mouth and constipation. Again, we're going to talk about limitation for Blossom study. First of all, exclusion of some of the pre-existing conditions mean that actually some patients who got some pre-existing conditions, they just excluded from this trial. High withdrawal rate. Again, here apparently that was actually one of the comments saying that discontinuation rate was higher a little bit in that trial. Limited the statistical power of EKG analysis. Like the EKG, the electrocardiogram, they did analysis was actually limited statistically, so there was not enough data statistically or clinically to prove the safety of that product. Okay, so as we said before, because we completely neglect the diabetes mellitus for those two trials, previous trials, so what we did plume diabetes mellitus. So we did this trial to really check on that kind of patients. So it's a multi-center, double-blind. We included 604 patients with diabetes mellitus treated with metformin, sulfonylurea, or both. Again, the age was from 18 to 65 with HbA1c of 7 to 10%, and the body mass index was from 27 up to 45%. Intervention. We give 10 milligram once or twice or placebo. So we give 2 milligram of Lorcaserin once a daily or twice daily or placebo against placebo. Endpoint, as we said, primary efficacy and safety of Lorcaserin in diabetic patients in weight loss. So it's not meant actually to treat diabetes, but it actually meant to treat weight loss among those kind of patient population. Secondary endpoints decrease the glycated HbA1c. So that actually was the secondary point, and we saw that actually there was some reduction in the HbA1c for those kind of patients, around 0.9% plus or minus. That's for the 10 milligram and for the once daily and twice daily. So again, here that's the change which we saw in the body weight. more patients actually lost more than 5% of their body weight with Lorcaserin. Here actually there is something very interesting, which an observation I'd like to bring your attention to, that if you can see here, the like weight loss in the, we can see the BID, the Lorcaserin 10 milligram BID is less than weight loss in Lorcaserin 10 milligram once daily. So that was actually one of the very kind of interesting observation we saw here. Unlike other trials, with kind of this diabetes patient, we found that with once daily, they have more weight reduction than twice daily, and that's actually very contingent with the rest. Sorry, very congruent with the rest of the charts. Again here, as we said, but regarding HbA1c changes, we found that 5% plus minus 0.5% was Lorcaserin PID, so there's really a good actually change in the HbA1c for those patients, versus 1% plus minus 0.09% Lorcaserin for the once daily patients. Okay, so here we're talking about the hypoglycemic attacks more observed in Lorcaserin group than placebo group. So maybe that was actually my interpretation to that kind of criteria we saw, that those kind of patients, they suffer, especially with the BID, as you can see here. Where's the hypoglycemia here? If you can really help me with that. Here, yes, right, symptomatic hypoglycemia. You can see here it's 7.4% versus only, this is
6.3.
This is 10% here, and this is 6.3 in placebo. So as we can see, actually here hypoglycemia is more with this kind of patients versus placebo. That's why maybe this is kind of one of the things we need to take care of and be careful about in our treatment with those patients. So safety and dosage. Adverse reactions reported by greater than or equal to 2% of Lorcaserin patients in more commonly with the placebo in patient with diabetes mellitus. Common side effects is, again, as we mentioned before, headache, upper respiratory tract infection, nausea and dizziness, nasopharyngitis, fatigue. So there was no statistical differences in valvular disease between the treated groups and the placebo. Dosing, as we said, immediate release tablet, it's 10 milligram twice daily orally. And we got also the extended tablet, which is on 20 milligram orally once daily. Dosage adjustment required, as we mentioned before, for moderate to severe renal impairment and liver impairment. So the clinical interpretation of this, as we said, Bloom trial, Lorcaserin results in greater weight loss and improvement in metabolic markers in obese patients as compared with placebo over 2 years of follow-up. Lorcaserin works mainly and as an adjuvant therapy along with lifestyle modification and a strict diet. Lorcaserin 10 milligram BID is probably effective and well tolerated. So again, for the Blossom trial, more follow-up actually are required to observe infrequent but serious side effects, which, as we said before, the heart valvulopathy. Results showed low level of association of Lorcaserin with FDA-defined valvulopathy. Valvulopathy is still observed in the Lorcaserin group. More studies should be actually done. And as we said before, the clinical data as called up to this point do not exonerate the drug for this potential risk. So, Bloom diabetes mellitus. In Bloom diabetes mellitus, weight loss has been greater among the Lorcaserin once daily group versus Lorcaserin PID. So hypoglycemic attack is maybe higher in Lorcaserin BID group, as we mentioned. So I don't know if we really have any thoughts what was the reason. Maybe there is some more studies has to be done about this kind of really phenomena, and we need to adjust that in the new clinical trials to be done on that product. So the summary of our actual presentation today, as we said, Lorcaserin is a selective 5-HT2C receptor agonist. Lorcaserin was associated with a significant weight loss and improvement in cardiometabolic parameters with a combination of exercise and diet changes. 10 milligram twice daily of Lorcaserin is a safe and tolerable. Post-marketing follow-up for infrequent but serious adverse effects are recommended by FDA. Lorcaserin 10 mg twice daily was associated with significant weight loss and improvement of glycemic control in patients with type 2 diabetes mellitus. This is a reference actually for that. Thank you very much. Any question? Thank you. How long?
29 minutes.